It's another beautiful Wednesday on the Women Series program. Thank you for joining me as always. This is the Women Series where we capture developments and stories that impact women. I am Ayomide Oguntoye, and this is the month of August. If this is your first time joining us on the Women Series program, let me officially welcome you. Thank you for joining me. Get your friends, your mommy, your daddy, your sister, your auntie, your grandma. I mean, nobody should be left out because we're about to talk about something very, very crucial and very important. Like I said earlier, this is the month of August, and throughout the month of August, we'll be talking about women in STEM. That is science, technology, engineering, and mathematics. And for this first episode, we will be talking at science. And the topic for today is women and their health, the benefits and implications. How about we consider the health part of our lives before going into talking about businesses, finances, and how to make money, how to become rich, how to get multiple streams of incomes and all of those sorts. Because as they say, health is wealth, and only the person with a good health definitely would be regarded as a wealthy person. So that's why we're looking at the women in STEM and considering the health part of it today. And I'm not going to be doing this all alone. I have a guest with me, the Southwest Regional Coordinator for the Planned Parenthood Federation of Nigeria, exactly where we are today. I'm speaking with Elizabeth Abimbola. Thank you for joining us today. It's great to have you, Ma.
Thank you for having me.
You're welcome.
I'm pleased to be here.
Yeah, how you doing?
Very fine.
How's work?
We bless God, it's moving on well.
Oh, very, very interesting. Let's quickly talk about the health. Like I said earlier, health is wealth. I mean, it is a very popular statement that we say all the time, and it is only someone that has a good health that can go around with their daily businesses. And we are very much aware of different diseases coming up, sprouting up every day, I mean, day in, day out. No one is new to the experience we had last year. That is the coronavirus that just met us at it was just came up at like a shock to everyone, and then we all had to live with it. Everyone started trying to keep safe, stay safe, use nose mask and all the likes. And it's the same way we still have new diseases coming up every day, right? We still have different things coming up day in, day out. How important would you say health awareness is?
Health, like you've already said, is wealth. And for you to be able to handle a particular situation, you really have to be well informed about that situation. And same thing goes for our health. If you are not informed, you wouldn't know what it entails.
Yeah.
Neither will you know the cause, neither will you know how to handle it or where to even assess treatment. So it is very, very important that everybody should be informed, should be aware about certain conditions that we are going through, or which disease condition is rampant, that you'll be able to know, what are you expected to do to prevent it, or to be able to manage it, peradventure you eventually have such challenge. So it is very, very important. Some people are not in the field, they may not know. Some are not even learned. Even though they are not learned, they are still entitled. It is still part of the fundamental human right for people to be informed about their environment and the situation around them and whatever their health is talking about. For example, in sexual reproductive health, we have what we call sexual reproductive health and rights. What's rights? You have rights to be informed, rights to information, rights to treatment, rights to quality treatment, not just any treatment. So, but if you are not informed, how will you know that you have a right? So it is very, very pertinent that people should be informed.
I love the fact that you pointed out about the fact that we need to be well informed. How would you describe people that go over the counter and just get drugs? Say, for example, self-diagnosis, basically. That's what I'm trying to say. Everyone feels like if you have malaria, the first thing you go to is just go to the pharmacy and just get malaria drugs. Like the moment you start having headache and whatnot. And recently I just heard about the dengue fever, that it has the same symptom with, and probably they are not treated the same way. I mean, would you kindly just in a few seconds just touch on importance of getting information in the right space, not just going over the counter to get drugs?
Yeah, thank you very much. That's a good one too, because getting right information leads you in the right direction. For example, talking about self-medication, it is very, very wrong for anybody to just pick a drug and use. Even now, in the era of ICT awareness for everybody, you go on the web, you can always search for anything you want to know and you get information.
Right.
Apart from that, we have professionals, trained professionals in all spheres of life. Now, talking about getting drugs on the counter, if you walk into a pharmacy today, we have professionally trained pharmacists that will not just give you drug, but they will have to run some what we call rapid diagnostic tests over their counter there, and then they will know whether you actually have malaria, and then they can treat you. And same go for other, little issues that we do have with the health. Even talking about reproductive health, there are so many rapid tests that you can take within minutes, and then you get your result, and then they know the appropriate treatment to give to you. Some of these chemists today, owners have been trained. Government is trying to co-opt them into the system, so that whatever they are doing for other professionals like doctors, nurses, these people are carried along. Their capacity is built to run all this basic investigation to be sure that you're actually treating this client for the right condition. So it is wrong for us to just get drug and take on our own without making inquiry, or you want to help your neighbor because you have taken the drug. Oh, you can take as well. The last time I had stomach upset, this was what I used.
Right.
Do you know what is causing the upset?
We're used to doing that.
Yeah,
that's
those
like
are part of the problems we're having. But now, awareness creation, capacity building for professionals and other paramedical people is helping us to wage war against such. Albeit, we still have some, cases that you may not be able to monitor, especially in the rural area, rural settings. And in the rural setting, we have a lot of this over-the-counter people business really thriving well. So they too are not left. Even traditional birth attendants, they are being trained now to do basic things with the pregnant women and make referral. Referral is key. If you train somebody, you know that your capacity lasts or exceed this boundary.
Stage.
You don't go beyond your boundary. You do whatever you are authorized to do legitimately, and then from henceforth you refer to the appropriate quarters for better management and quality services. So please, information is key so that you don't go off.
I mean, that's why we're here, right? Information is key, to get information and to get it across to people. As much as anyone that needs access to this information, it is readily available to you. Now, I'm aware that the organization is currently running an outreach for women, especially in area of breast cancer and cervical cancer, which of course is pertinent to women alone. Could you touch on that? I mean, let's first of all hear about the implications of not even getting to do tests like this.
One thing, I love that area you mentioned. Planned Parenthood, we do everything about sexual reproductive health, family planning, cervical cancer, whatever, immunization and things like that. But talking about cancer that you have just mentioned,
it is big.
Is one big condition that is killing both male and female. But unfortunately, women are more affected than the male. And the highest or the leading cancer in killing people is the breast cancer, followed by cervical cancer. They come in that order. So breast cancer kills so fast just because people are not informed and they don't know where to go when they see these cardinal signs in them. Unfortunately for cervical cancer, it doesn't even give you symptoms. It doesn't give you signs. By the time the signs and symptoms will be coming up, it will be done too late.
Wow.
So that is why information is key. And for breast cancer, we give information about routine self-breast examination for women. That a lady of reproductive age, once you have commenced menstruation until about 59 years, that is 15 to 59 years is the age bracket, but now we have people menstruating even below 10 years.
Yes.
So a lady or a girl is trained to be able to examine her own breast personally by herself at least once in a month. And she should not forget this. Maybe you tag it to your menstrual cycle that the last day of your menses you will examine your breast and be sure you are okay. That is very, very important. At least it will save a lot of life. Because if you find that you can locate a lump in the breast, or you see changes in the size or the color, or the nature of the skin over the breast, obviously something is wrong. You may not know. Quickly go to the medical personnel and let them examine you and be able to rule it out and say, oh, you are fine. It is just one of those things. But what you don't know is that seeing a professional will help you out. You palpate your breast to examine once in a month, or once you have reached the age of 40 years, let every woman at least once in a year carry out mammography.
I mean, I feel like you should repeat that again, like after 40 years.
After 40 years,
yes,
every woman should make sure she goes for mammogram every year, once in a year. It's not too much. It's not too expensive for your life. It is because you are healthy that you can go out there and make wealth.
I know, right?
So it's not out of place, but unfortunately for us, in this side of the globe, we don't really cherish investigation. We'll be considering the cost. And I do tell women out there in the communities, it is because you are still standing on your feet that you can go to do your trade, that you can go to work if you are the working class group. So whatsoever you want to achieve, make sure and ensure that you keep yourself in good health, especially the women folk. I do emphasize this because they are the receiving end.
Yeah.
Right from the age of puberty, you commence menstruation. Your body has started being subjected to all forms of physiological changes. You talk about sex when you are matured for sex. That one too has its own challenges. If you are not exposed, you are not sexually active, you need not to be fret about any infection that has to do with HPV, that is human papilloma virus. That is the virus that is responsible for most of those cancers that affect the reproductive parts in the women. Then also you want to talk about pregnancy. When pregnancy comes up, we know what it takes to go through that 9 months. Delivery is another dangerous zone. It's only by the grace of God and good care that you come out of it alive. And then also you talk about menopause. So women are subjected to a lot of physiological changes that goes in stages with their advancement in age. Obviously, if you know this is the way you are made, like the Bible says that we are beautifully and wonderfully made. Fine, yes, but we are also delicately made as women folks. And our body is, experiencing a lot of changes that it's wearing and tearing, is coming up so frequently that you, the owner of the body, need to maintain that body. It's like having a car and you use this car to travel every now and then. You can't compare it to someone that has a car that is parking, just occasionally go out for maybe a party and you park it again. No, that cars that work so frequently need to be well serviced, need to be well managed so that you can enjoy it for long. So for you to sit down and enjoy the fruits of those labor, you really need to manage yourself well and take good care of yourself. And part of it is exercising, investigating, and getting information about your health so that you can keep fit and sit back to see the beauty of those children that you have raised. So it's very, very important that people should be informed. When it comes to cervical cancer, you don't even have any symptoms. By the time the symptoms will come, it is too late. So the only thing that can help you out is screening. Every woman of reproductive age is advised to screen herself at least once in a year. The screening could be by pap smear, it could be by VIA, visual inspection with acetic acid. So it depends. You can do cell cytology, you can do HPV cytology. You can, these are the investigations for you to run and know whether you have any trace of this cancer in you before it becomes a full-blown cancer. For cervical cancer, you can pick it at the precancerous stage. And when it is picked at the precancerous stage, it can be managed. That is one beautiful thing about cervical cancer. If it is diagnosed early, it can be treated. Gone are those days when they will tell you that you cannot treat cancer. Even breast cancer, if it is early diagnosed, you can remove the lump. When you detect that and the diagnosis is confirmed, they can remove the lump in good time and you still save that breast. But when it is too late, you may end up having mastectomy where the whole breast tissue is removed, and that may not be too good because the prognosis then may be bad. Even with chemotherapy, radiotherapy, it doesn't really work well in most cases. We have lost so many precious souls to this kind of ugly situation. So please, it is important for women to please take good care of their health and make sure that they keep themselves in good and sound health by doing their routine check annually.
I mean, it is just very simple as just what you just said. It's as simple as ABC.
Yeah.
Get yourself checked. Be informed as much as possible.
Exactly.
It is not difficult. I mean, if you care so much about your hair, you care so much about your shoes, you care so much about your dresses, what's stopping you from caring so much about the body that is going to even wear all of those things you think about? It is as simple as that. We should stop taking things for levity. It is as simple as ABC. He that has ears, I mean, they say, let him hear. That's how simple as it is. How can we get access to all of these things that you just said now?
Yes, like Planned Parenthood Federation of Nigeria, in all our outlets, we are present in every state in the Federation and in the Federal Capital Territory in Abuja. For my site in Southwest, I coordinate activities in Southwest region, all the 6 Southwestern states. We have our facilities all over. You can check us on the web. Check web page and you see PPFN facilities where we are located, and you can always access this screening in any of our clinics. For Lagos State, we have a clinic in Isolo, that's number 1 Victoria Street off Osolo Way. You can always access services in our facility between the hours of 8 to 5 p.m. on the weekdays, Mondays to Friday. And some corporate organizations do invite us to come and carry out this service. We do outreaches where we can come to your base and then set up a mini clinic there and then conduct the screening for them. So we do screening for cervical cancer through VIA, and then for those who are positive with precancerous cells, we do what we call cryotherapy for them. And we have our networks of tertiary institution where we refer complicated cases to, or those who have advanced for further management. We work with LUTH, we work with UCH in Ibadan, and so many other tertiary institutions around the country. We have specialist hospitals that work with us in our network, and then where we have other cases that we may refer. Because when you do your screening, a lot of things are exposed that you do not know. Because you cannot see your cervix by yourself. During the course of the screening, you can detect a lot of abnormalities that are already going on there, but the owner of the body does not know. You can see good growth, you can see cysts, and all sorts of things already happening. You see warts growing, and you can quickly inform or refer to the appropriate place where the surgery is conducted in time, and the woman lives her normal lives to enjoy it to full time. So then I also want to talk about the area of some of us that we tend to believe that cancer cases should be kept away from people. Unfortunately, I just lost somebody last week, and so painful. We know when people have cancer, either of the breast or whichever part of the body, people tend to say, I don't want people to know I have cancer.
Speak out. Let people help you.
If you can't go to the right quarters, let people who are professionals point you there. Maybe you don't know the right quarters to go. Let them point you there. And when you get there, you get the best services in good time, not when it is too late. They say a stitch in time saves 9. So people should please stop hiding this. Stop going to mountains to pray when you have cancer. We can always pray. I'm not disputing the power of prayer. I'm not disputing that there is divine healing.
Well, the Bible says walk and pray.
Yes, you walk and pray. The Bible says faith without work is dead. So if you have faith in prayer, then walk towards it. That the hospital where you are going, the power of God will go ahead with you and then make use of hands there to manage you appropriately.
Thank you very much. I mean, I feel like we should continue this conversation because there are a lot of questions I would even really love to ask. But then we can have these conversations in the comment section below. You did not talk about the amount for the screening. Is it free?
Yeah.
In 2 seconds, let's just quickly
in the rural area, how to be this less privileged and vulnerable people, we do it for them freely. But for other people, we do it with a token of 1,000 naira.
1,000 naira, you can get yourself checked. I mean, 1,000 naira. How much does it cost you to get your hair done? How much does it cost you to get fix your nails, do your pedicure and manicure, get your dresses, your bag, your Chanel bag? It costs more than that, but now they are telling you to get yourself checked with just 1,000 naira. I don't know what you're doing with this information, but then again, prevention is better than cure, and he that has ears, let him hear. Thank you very much, Ma, for coming on the program. It was great having you. And thank you for even allowing us in your space. We really appreciate it.
Thank you so much.
And that will be all for today's episode of the Women's Series. If you've got questions and comments, please let's keep up with the conversation. If you have any questions or you want to reach out to her directly, please leave a message in the comments below, and definitely would reply or give a response to you. And on the next episode, we'll be looking at technology. Please make it a date with me next week on Wednesday on www.proshareng.com/webtv. And until next time, thank you for watching.